Hey, this is Cooper again with a episode of Are You Kidding Me? All right, now let's take a logical look of this. Back in June, I made a post right after the one of the first riots, and I said within a 14-day period of time, if the virus was as detrimental as it was claimed, that you would have an influx within 14 days of individuals going to the hospital. Now, I'm not talking about the conditions that people have been trained to listen to about cases. Cases are not a death sentence. You have a case when you have a flu. You have a case when you have the cold. You have a case when you have a toothache. Okay? Now, let's look logically at what's going on. Just logic, sheer logic, no political party, no, just logic, straight up logic, okay? We had riots in Minnesota 3 days after the individual passed away under the knee of an officer. That whole controversy is a different controversy of its own. Now, 3 days after that, you had hundreds, if not thousands, of individuals get together, no masks, no social distancing. And I said to my wife, I said, if we do not have an influx of ICU patients after this riot, there's absolutely no reason for the general public to fear at all. Okay? 14 days have passed, no increase. After that fact, they started testing more people. Okay? And so our numbers of cases have gone up. Okay. All a case is telling you, because they're not telling you what the science is of what the diagnosis of what a case is. What is a case? A case is they test you, and they can only test for two things: active virus and antibodies. But the tests that they have don't differentiate between active virus and antibodies. It doesn't differentiate it. The only thing that differentiates whether a person has active virus is whether they have onset symptoms. So when you test a person and they have a case, they're usually past the active virus. That's what they're not telling you. Logic. So now it is now July. We have never had the influx of individuals going to the ICU and dying after those riots. None. Zero. Yes, I'm not diminishing the fact that there is a virus. Logic. But it's a virus. Logic. Walmart has not required a person to wear a mask till this month. And you've had countless thousands of individuals go through Walmart, and you don't have an influx of death. Now, from what I've been gathering, is they're equating death to the virus, and they have everybody fearing death. Okay, so let's logically look at that. I went through and looked at all the states that had rioting. Now, you would think that because of all that non-social distancing, that every single one of those states, and catch this, people, those states are red and blue states, so it's not political. So no matter how you have somebody from one side try to tell you that it is, it's not political. The virus has no political party. It doesn't. It attacks everybody equally. So if that were the case, you would have the influx after every single one of those riots within days, because it doesn't have a long incubation period, an influx directly into the hospitals. Directly. There's no, if because of what you're fearing by not wearing a mask or not wearing a mask, because of what you're saying, if you have a living experiment, you don't have to listen to Dr. Fauci. You don't have to listen to the governor. You don't have to listen to the mayor of any town anywhere on the planet. You have your own case study that has proven itself out in front of you. So you don't, logically, you can look at it. You have not had an increase of death in those people who have done rioting. You haven't had an increase of sickness in those individuals. You haven't. It has not happened. But you do have the media over and over and over again feeding you cases. The cases are up. Now, let's look at the hotspots that have ICU over capacity. Do you realize that the average hospital at capacity has 10 patients in the ICU? So when somebody shouts that they're at capacity, that they're at 10? And for the population that's around them, that's a low number. And hear me out. I do not wish harm to any people, and my heart goes out to those people, loved ones that lose somebody. I'm not talking about that. I'm talking about the science that you're not paying attention to logically. Some people are going to get it and some people are going to die. It's logic. But now let's look at another factor. If the virus was as deadly and should be feared as much as it should be feared, why do we not have an influx of death in homeless people? They don't have any social distancing. They don't have any hand washing. They don't have any health care. They don't have any access to any of the sciences that you're talking about. They're not looking at videos. They're not face covering. They're not doing any of it. They're not dying. They're not dying. And then you go question, well, you have all these deaths of our seniors. People, they took COVID patients to the seniors' homes. You want to know why they took COVID patients to the seniors' home? Because they could have necessary care. And this is bad to say, but it's a fact. And it's not easy to say. What is 99% of the outcome of an assisted living or senior care? What is 99%? Only 1% go in for rehab and come out. 99% come out and their relatives gather around them and have a viewing. It's not the fun thing to think about. It's just the truth. Logic. No, and I would say this in all my videos, I don't want anybody to die, but I want people to look logically. You've got governors that are killing their businesses and state for whose gain. You've got a guy in the White House, that the medical director who's living out his dissertation and telling people to follow this and follow that. because he's trying to see what people will follow. He's writing another dissertation of some sort. Logic, it's not there. Another example. Our president had a rally. If what we were saying is true, it's been 14 days. You'd have a lot of death. Not cases. Now, one more thing I want people to put into their thinking process. If you're going to test for corona, ask the news and the media to post, while you're testing, how many people have H1N1? How many people have pneumonia? Last but not least, the numbers aren't adding up, people. And somebody's getting paid by these numbers. Somebody is. I talked to a friend from a reliable source who had a brother-in-law and sister sign up to get tested. For some reason or another, couldn't make the test and got a letter in the mail that they were tested positive, and they were never tested. So, there are some flaws in the testing. Somebody's getting paid for how we're being devastated, and the recovery of this United States is going to be tough, and whoever becomes president in November, it's going to be a mess regardless. I wish the best to whoever. But from the logical standpoint, people, something's wrong with the information. If the information that we had been provided were true, you and I would be sick already. That's the logic.